Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today we have a special sponsored episode from the Academy of Continued Healthcare Learning and supported by educational grants from Lilly and Genentech, a member of Roche Group. A special thanks to the National Alliance on Mental Illness Chicago for participating in this program. Today, we will be discussing Alzheimer's disease, advice and strategies for patients, caregivers, and primary care clinicians. Find out more at diagnose-alz.org. That's diagnose-alz.org. Today, I'm joined by three individuals. First is Dr. Andrew Budson. He is Chief of Cognitive Behavioral Neurology at the Veterans Affairs Boston Healthcare System and Associate Director at my alma mater, the Boston University, Alzheimer's Disease Research Center, Professor of Neurology at Boston University School of Medicine, and Lecturer in Neurology at Harvard Medical School. Next is Jess Rapay. Jess is president of a design and marketing firm in Chicago. She's passionate about mental wellness and is a longtime volunteer and board member of the National Alliance on Mental Illness Chicago. Her journey with Alzheimer's is through her experience as a primary caregiver for her mother, who has been living with the disease since diagnosis nearly 4 years ago. And finally, we have Ellie Friedman. Ellie is the owner of Wildwood Tavern in Niles, Illinois. Ellie's father was diagnosed with Alzheimer's disease in 2010, and she was the primary caregiver and medical liaison throughout her father's illness. Andrew, Jess, and Ellie, welcome to the show.
Thank you.
Thank you.
Thank you
All
so
right.
much.
Andrew, we're going to start with you. What is the role of the primary care clinician in the diagnosis of Alzheimer's disease?
Well, first, it's important for the primary care provider to look for any symptoms that are suggestive of Alzheimer's. Next, it's important to do a workup, of course, including a history of the thinking and memory problems, physical neurological exam, some blood work to rule out vitamin deficiencies and thyroid disorders, and a brain scan to look for a stroke or other neurological problem. Then, using all that information, I would like the primary care provider to sort out whether it's normal aging, whether it's Alzheimer's, or whether it's something else. If it's Alzheimer's, I feel very comfortable with the primary care provider themselves doing the counseling and the treatment. If it's something else, that's a good time to refer the individual to a memory specialist.
So, Andrew, I just want to follow up. Take us into your exam room, and I'm an internal medicine physician myself. What would be some tip-offs, some presentations that would make me think I would need to do further evaluation for Alzheimer's?
Sure. If the patient themselves says, I'm having trouble remembering my appointments, or I've noticed that I'm late and paying bills, or I'm having trouble finding my words, I'm getting lost going to places I normally could go to, or I'm losing things left and right like never happened to me before, that's one tip-off that would be concerning. But as you well know, often it's the families that are coming in and they're saying, my mother is repeating the same question again and again and again, or my father is telling me the same stories over and over and over again. And often when the family speaks with the individual, they say, I don't have any memory problems. My memory is just fine. All of those things would make me concerned.
And Jess, what part did primary care clinicians play in your mother's diagnosis?
Well, it's interesting, because listening to Andrew's gold standard of how you'd like it to go, I was listening to you thinking, does that parallel my experience? And in some ways, yes, I would say that the primary care, doctor, was obviously the first go-to place for my parents, and they did provide some screening. I would say in our experience, it was very light in terms of a simple, like a few question cognitive screen. And it didn't really evolve into blood work and some of those subsequent steps until my mom's cognitive issues started presenting themselves physically, i.e. she started falling down. And so when she began to fall, all of a sudden it was like, oh, why is she falling? And so it was a response to maybe a more physical manifestation of a cognitive issue that we'd been, asking the doctor about for some time, but we weren't getting a lot of traction there. So the screening happened, some blood work eventually happened, but as her experience became more around worries about falling or hitting her head or other things, at that point we were referred to a neurologist, but that took some time.
And Ellie, when did you first become aware of your father's possible memory problems, and how long was it before the problems were mentioned to a clinician?
I personally didn't notice. My mom came and finally told us, and a friend had noticed when my dad was golfing that he couldn't find his golf ball anymore. And that was very unusual. And he happened to be a psychiatrist. And he mentioned to my mom that my dad might be having memory problems. There was, when he'd go for his annual visits to his primary care physician, there was nothing done at that point or questions asked to my mother or anybody else if he was having memory problems. And then she finally told us, and once she told all 5 of us kids, that's when I took over and said, well, we need to look into this further, find out what's causing that. And then I also noticed he was always talking or eating, because we called him Jaws. So he stopped his social interactions, and his social things started to digress. And he wasn't as socially interactive with people as he had been in the past.
So Andrew, as you listen to these stories, would you say that these are typical presentations of what you will see in the exam room?
Well, it's interesting, and I think it highlights that every individual with Alzheimer's disease is a little bit different, and they present in a little bit of a different way. Jess explained that one of the manifestations that she experienced was there was trouble with falls, and that isn't typical of garden variety Alzheimer's disease, but sometimes can happen if there are mini strokes or if there's a Parkinsonian disorder, then falls can come about. And then we heard from Ellie that there was trouble not only losing things like golf balls, but also becoming withdrawn and becoming less likely to initiate actions and activities and social events and conversations. What we call apathy is actually very common and is one of the earlier signs of Alzheimer's disease. It can also, however, be due to depression. So that's always something that I'm working, and I know the primary care providers work to sort out. Is this trouble with depression, or is this an early sign of Alzheimer's disease?
Ellie, at what point did a primary care clinician indicate that they suspected Alzheimer's disease, and how did they discuss it with your father and your family members?
Basically, my father had depression, like Dr. Budson said, and he had the onset of Parkinson's. So it was kind of like a three-for-all, 3 things at one time. So he was also part of the VA in Chicago in the Great Lakes facility, and we just started bringing him to a neurologist there. Our primary care physician said, I would recommend you go see a neurologist and have a brain scan and do testing. So he really didn't play a part at all. He just recommended us go see a neurologist.
And Jess, what initial steps did a primary care clinician take or recommend? Was it a test or a referral?
After quite a bit of prompting and, me feeling like the, annoying daughter saying, something's not right with my mom, something's not right with my mom. Then it was like, okay, you need to see a neurologist. So then the referral was made, and we took it from there and did a pretty comprehensive neuropsych evaluation and scans.
So talk about that neuropsych evaluation. What did that entail?
I was trying to dig up the results before we talked today because, the report that came of it, I remember being so fascinated by it because I attended the family conference at the end after all the tests were done. And it just was, it was comprehensive and very educational. They did do a great job. So they spent quite a bit of time with my mom, doing a variety of cognitive exercises in addition to those scans. And They showed us sort of, where she fell on the bell curve, right? And how she compared to others at her age, so she was just 70 years old when this test was taking place. And so it was really informative and educational for me, very overwhelming for my parents, a lot to take in. But if I recall that the culmination of that was that a firm diagnosis is difficult, but that what we're seeing here is what symptoms that are consistent with white matter disease and what appears to be consistent with Alzheimer's. So it was presented as, a guide for what we appear to be observing with your mom.
Andrew, what advice would you give primary care clinicians for navigating the initial diagnostic steps, and how would you discuss them with patients and their families?
The first thing I want to say is I feel strongly that any of you primary care providers out there listening, you have the tools that you need to make a basic diagnosis of Alzheimer's disease. As I mentioned, take a history, do the physical and neurological exam, get some blood work, do the scan, do a little cognitive testing in your office if you have the capabilities, either yourself or an assistant, or refer the patient to a neuropsychologist or, somebody that can do that testing. There's also questionnaires that you can have your secretary hand to the individual or hand to the family in the waiting room. They can give you a lot of information which will suggest as to whether Alzheimer's disease is likely to be present or not. And, how do you discuss it with the individual or their family? I think you say something like, Mrs. Jones, you've shared with me that you've noticed a couple of minor memory lapses. We're going to run a couple of tests, make sure you don't have a vitamin deficiency or a thyroid disorder. And we want to do a brain scan to make sure it's not a stroke or some type of brain disease. So that's usually how I go about starting off the evaluation.
Now, Andrew, how often do patients or family members decline additional testing towards Alzheimer's disease? And from our experience, why does that happen?
Yeah, it definitely happens sometimes. One reason that the individual or their family would decline is they feel you can't do anything about memory loss. It's relentlessly progressive. So why should I bother doing the evaluation? Another problem that sometimes can come up is the individual is afraid of a diagnosis of Alzheimer's disease, or the family is afraid of, telling their parent, for example, that they have Alzheimer's, feeling it would be catastrophic. In my experience, it usually the individual is okay with it because they've usually noticed that they have some memory problems. It's not generally a surprise to them. And I can honestly say more people feel relieved that finally they know what's going on, there are treatments available, and they're going to get help. But I will say the biggest problem that I hear in my clinic is that a lot of their doctors haven't sorted out what was going on before they came to see me. And I think it can be difficult. I know when I was in medical school, which was a year or two ago, it really wasn't covered. It wasn't really discussed, and I worry that a lot of primary care providers are feeling like they don't know exactly how to make this diagnosis or whether they should be making this diagnosis. And again, I want to send the message out there. You can do this. It's not that difficult.
Jess, what was the impact of the possibility of Alzheimer's disease on your family relationships? What were some of the reasons for continuing the diagnostic process?
So the second part of your question I'll address first. It's just like seeking to understand and continuing that process just to feel some, relief and understanding what was happening with my mother so we could, best respond and care for her. So I think for us, knowing that it was likely Alzheimer's, I could quickly get resources for myself to understand how I could more effectively communicate with her and how I could help my father understand these changes in his wife and how we could, help my mother not be afraid. And, Andrew's right. My mother didn't fear that she was like, okay. But also the stigma just around the word Alzheimer's. Like I hear people say, oh, sure, my mom has some dementia, but it would never be Alzheimer's. Like just our own human coping skills and sort of our fear of certain diagnoses based on what we've been led to believe those words mean. So I think the word Alzheimer's in my experience, scares people. So that's why conversations like this are important, to kind of have these conversations and take the stigma away from that word. It's simply a diagnosis, and it's simply a very broad potential pathway for your loved one that is just helpful. And so you can understand and respond, not to put you in a pigeonhole and be, a tragic outcome.
And Ellie, I'm going to ask you a similar question. What was the impact of the possibility of Alzheimer's disease on your family relationships, and what were the reasons for stopping the diagnostic process?
The reason for stopping the diagnosis was my mother's choice, because she was very much with it when she knew my father was diagnosed with that. And us kids were not going to fight with her. That's her husband. We let her make that decision. My father, I think, was okay with it, although he did get depressed about it. And that was probably the hardest part for her. And for her also to admit that he had Alzheimer's was the hardest thing too. At that time, there was no path or, okay, this medicine will help you go on for X number of whatever years, or will help your memory loss be delayed further. There was nothing at that point. So she didn't want to go any further with testing. It was very difficult for her even to look at the brain scan and see how much of the brain had deteriorated already. And that was very painful for her. So she didn't want to go any further. The dynamics in our family, there's 5 of the kids, and 3 of us stepped up to really support her in any way that we could. And I think that was more important at that point for her, for the whole functioning of the whole thing, because my dad was going to be taken care of no matter what, right? It was her that needed more taken care of to understand it and to accept it.
You're listening to a special sponsored episode from the Academy of Continued Healthcare Learning and supported by educational grants from Lilly and Genentech, a member of Roche Group. A special thanks to the National Alliance on Mental Illness Chicago for participating in this program. We're discussing Alzheimer's disease, advice and strategies for patients, caregivers, and primary care clinicians. Find out more at diagnose-alz.org. That's diagnose-alz.org. Jess, how was the diagnosis of Alzheimer's disease eventually made?
It was, through that neuropsych evaluation, and really then experiencing all of a sudden with that lens of, we think your mom has Alzheimer's. All of a sudden you start to look back at all the other, in hindsight, the other things that line up with that. And so it really made sense. And so it was really that evaluation that put a pin in that, and then we could move into caregiving with some sense of clarity what she was experiencing.
And Jess, when you received that firm diagnosis, what were some of the benefits of that?
I think for me, some relief, a lot of fear and uncertainty, but the benefits were then we could say, okay, I'm going to join a support group at NAMI, or I'm going to go, I went to alz.org right away, and I'm looking for caregiver resources. And my parents' county where they live happens to have a great aging and disability resource center. It took me from a state of worry and wondering what was going on into sort of a state of, okay, now let's take some action to figure out how we can give my mom the best life possible. So it just moved us from one stage to another in a way that was really helpful for our family.
And Ellie, in retrospect, would you have preferred knowing with greater certainty if your father had Alzheimer's disease? Why or why not?
I think we knew that he had that. At that point, it was dementia or Alzheimer's. They never really clarified for us what it was, but at least we knew what it was. And again, doing research online and looking at things, I would exercise him every day. I would get him outside to walk every day, make sure he was drinking enough water those certain things that I just read about on our own, and keeping him at home for as long, because that was his environment. And he always said he never wanted to go in a nursing home, but we convinced my mom that when it's time, you'll know it's time. And it was time at the end. And even when he was in the nursing home, we would exercise him every day and take him outside. And even the nurses says your dad lasted longer than most of the people do because of the care that you guys gave him. So I feel that we just started a different path because we knew what it was and how to handle it and it was important to give my mom time away from it also, and that we worked into our plan is made sure that she had time to get away, go do yoga or whatever she needed to do so she could care for him when she needed to also.
Andrew, what would you tell primary care clinicians about the benefits of diagnosing Alzheimer's disease so they can better counsel their patients?
Sure. There are so many benefits. The first is it's, of course, important to rule out other things, rule out vitamin deficiencies, thyroid disorders, strokes, do they have, some sort of collection of blood in their head because they had a fall and they now have a subdural hematoma? Do they have too much fluid inside the brain, so-called hydrocephalus? So that's the first reason. And then, I think it's really important when you're, making any sort of a diagnosis to really work on helping the individual and their family to sort of confront this disease, let them know what's going on. And then we can prescribe medications. The cholinesterase inhibitors, they've been shown to be able to turn the clock back on the disorder for 6 to 12 months. And that turning the clock back will still stay with them 6 to 12 months later. It just doesn't change the rate at which they go down, but they're always going to be better off on that medications. And that improved function can help the individual do things they want to do on their bucket list. They can take that last vacation or do something with family, write their memoirs, all those things with that level of improved functioning. And then, it's also very important to give time for folks like Jess and Ellie, time to do planning and get ready for the disease, as it does progress. And lastly, I'm actually pretty excited that there are some new medications to treat Alzheimer's disease that are being developed that may eventually slow down that ticking clock. So I'm very excited about the future, and I think it's important to diagnose Alzheimer's for all those reasons.
Jess, what advice would you give to patients and family members about a potential diagnosis of Alzheimer's disease?
Advice I would say, just remember it's not a death sentence, and it's also a family disease, just like any diagnosis, right? It's not the person that receives it. It's all of us who love that person receive that diagnosis. And that's not designed to be intended to be a scary statement, but more of a supportive one that we're in this together, and that we all play a role, and we're all grieving and we're all feeling impacts of it, in some ways much more than the individual with the diagnosis themselves. I mean, it's reverberated through our family with some positive outcomes, for sure. We've grown closer in a lot of ways. We've had to galvanize as siblings and figure out what are we going to do here. And I feel really lucky that we are all on the same page with that caregiving role, but just remembering that you're not alone in this.
And Ellie, similar question. What advice would you give to primary care clinicians about the diagnostic process and how to discuss it with patients and their families?
I think be real positive, because it is, like Jess said, it's not a death sentence. You still have that person here, and everybody's still functioning, and you have to plan for the future. Planning, I think, is the biggest thing. Take up the rugs from the floor, so they don't trip. You just have to plan and work together. I think working together is the best thing, and your siblings all come together to make sure that person is taken care of, because it's someone you care about and love. And I always say, my father died 2.5 years before he really passed away, because he was a different person. So now this is a new person that you need to get to know, and how you have to learn how to care for. And that's okay, but he's still your father, and I think that people can't be afraid of that. And I wish the stigma wasn't there, because a lot of people are afraid of the word. And I think there needs to be more hope put onto that word that there is hope, that it's not like a death sentence right away. There is hope to keep going. And I think that's the message that has to be sent out to the caregivers and the primary care physicians. This isn't a death sentence. You can still function.
And Jess, what challenges do you face in taking care of your own mental, emotional, and physical health? And how do you overcome those challenges to take care of yourself?
Well, I guess, there's that desire to do everything, right? You want your loved one to have the best possible. And you have to let go of what should be and say, where are we right now? And what's the best today? And that's different than you expected, right? You have to accept the challenges, accepting that my relationship with my mom and what's possible for her in her 70s is different than she dreamed of and that I dreamed of for the two of us. So accepting that, and I would say overcoming that is really in community, like even like this, talking and hearing Ellie's story and talking to other people and storytelling and sharing for me is just the way to heal and to stay stable and strong for my mom.
Andrew, what strategies would you suggest for helping primary care clinicians overcome the barriers to diagnosing Alzheimer's disease in their practices?
Yeah, I think you just have to make diagnosing memory problems routine and part of your practice, just like you diagnose problems with any other organ system. I would ask about memory problems, just like you ask about, are they having symptoms of heart failure or asthma or GI problems or anything else. And I would even advocate incorporating either cognitive tests or those questionnaires that can be filled out in the waiting room every year for their patients who are 65 years and older.
All right. And I'm going to ask each of you for your take-home messages to the Kevin MD audience. So Ellie, I'm going to start with you. What are some of your take-home messages that you want to share?
I think it would be great that what Dr. Budson talked about as a checklist, if everybody got that, like did a baseline like they do with colonoscopies, okay? Do a baseline at 60 and see where your memory is and what your brain function is and what your brain scan sees. And then do it every 5 years to see where you're developing. I think a checklist that you should get from your doctor to see if you're having any of those issues. Currently now, and I think it's been since COVID, you go in to see your primary care, they ask you about depression. Are you depressed? Have you been depressed? Why not have the same kind of questions asked at the end of a physical or while you're discussing things with your doctor? I mean, that could make one the word doesn't become so taboo anymore. Everybody talks about it. And I believe everybody has been involved or knows somebody who has had Alzheimer's or dementia. Maybe the information of explaining the difference between the two of them. I think that would be very helpful. Just have a baseline and then be able to check it every 5 years, like a colonoscopy, or every 10 years.
Jess, what are some of your take-home messages to the Kevin MD audience?
Yeah, I mean, I echo exactly the same thing as I think back about other physical challenges my mom had, whether it was gastrointestinal or, different things, because she did have some thyroid issues. Those were very proactively addressed. And the mental cognitive stuff was sort of like, oh, okay, let's talk about it. It felt that there was even some, residual stigma, even in how it was evaluated. It was sort of the last thing and it was a little bit dismissed. And so just bring that farther forward more consistently and treat it with that same, lack of emotion. It's a factual screen, and it helps us all not be afraid of it when we feel that energy from the physician, that it's not something you need to be afraid of. I think that really carries a lot of weight, even in the words that are used and when it's presented in the exam, and how comfortable the physician is talking about it is really, really powerful, the unspoken pieces.
And Andrew, we'll end with you. What are some of your take-home messages that you want to leave us?
Most of the medications that are used to treat memory loss, they work best when they're given early. So if you are concerned about memory loss in yourself or a loved one, my recommendation is don't delay. Make an appointment to see the doctor today.
Thank you very much for listening to a special sponsored episode from the Academy for Continued Healthcare Learning and supported by an educational grant from Lilly and Genentech, a member of Roche Group. A special thanks to NAMI Chicago for their participation in this program. Find out more at diagnose-alz.org. That's diagnose-alz.org. Jess and Ellie, thank you so much for sharing your stories. And Andrew, thank you so much for sharing your insight. Thanks for being on the show.